Let us now learn about scalp. Soft tissues covering the cranial vault form the scalp. Soft tissues covering the cranial vault forms the scalp. Extent of scalp. Anteriorly it extends up to supraorbital margins. Anteriorly it extends up to supraorbital margin. Posteriorly it extends up to external occipital protuberance and superior nuchal line. Posteriorly it extends up to external occipital protuberance and superior nuchal line. On each side it extends up to zygomatic arch. On each side it extends up to zygomatic arch. Anteriorly it extends up to supraorbital margins. Posteriorly it extends up to superior nuchal line. On each side it extends up to zygomatic arch. Layers of scalp. Scalp is made up of 5 layers. Remember the mnemonic scalp. S. Skin. C. Connective tissue. It is superficial fascia. A. Aponeurotic layer. L. Loose areolar tissue. P. Pericranium. Now let's see each layer in detail. First layer, that is skin. Skin of scalp is hairy except over forehead. It contains numerous hair follicles, sebaceous glands and sweat glands. Skin contains numerous hair follicles, numerous sweat glands, numerous sebaceous glands. As it contains numerous sebaceous glands, it is commonest site of sebaceous cyst. Second layer, connective tissue. It is superficial fascia of scalp. Second layer is made up of dense fibrous connective tissue. Second layer is made up of dense fibrous connective tissue. This layer firmly adheres skin to underlying epicranial aponeurosis. It is made up of dense fibrous connective tissue. It firmly adheres skin to underlying epicranial aponeurosis. It contains blood vessels and nerves of scalp. You can see the second layer. It contains blood vessels and nerves of the scalp. Walls of blood vessels are adhered to connective tissue. Hence they are unable to retract. Thus, profuse bleeding occurs when there is injury to these blood vessels. The walls of these blood vessels are firmly adherent to the adjacent connective tissue. Hence, they are unable to retract. As they are unable to retract, they cause profuse bleeding when they are injured. Third layer of scalp, aponeurotic layer. This layer is formed by occipitofrontalis muscle and its aponeurosis. Occipitofrontalis muscle and its aponeurosis, epicranial aponeurosis. Occipitofrontalis muscle has two frontal bellies and two occipital bellies. It has two frontal bellies, two occipital bellies. Both the bellies are inserted into epicranial aponeurosis. You can see both frontal and occipital bellies are inserted into epicranial aponeurosis. Frontal bellies. They are longer and wider. They are longer and wider. Origin of frontal bellies. They arise from skin and subcutaneous tissue over the eyebrows and root of the nose. Insertion. They insert into epicranial aponeurosis. They arise from skin and subcutaneous tissue over the eyebrows and root of the nose. They get inserted into epicranial aponeurosis. Fibers of frontal belly merge with procerus, corrugator supercilii, orbicularis oculi. The deep fibers of frontal belly merge with procerus, corrugator supercilii, and orbicularis oculi. Now supply. Frontal bellies are supplied by temporal branch of facial nerve. You can see the frontal bellies. They are supplied by temporal branch of facial nerve. Action of frontal bellies. Raises eyebrows. Produces horizontal wrinkles in the skin of forehead. They have no bony attachment. Frontal bellies are arising from skin and subcutaneous tissue. They are getting inserted into epicranial aponeurosis. Hence they do not have any bony attachment. Frontal bellies are longer and wider. They arise from skin and subcutaneous tissue over the eyebrows and root of nose. They get inserted into epicranial aponeurosis. supplied by temporal branch of facial nerve, raises eyebrows and produces horizontal wrinkles in the skin of forehead, have no bony attachment. Occipital bellies. They are small and are separated. You can see they are small and are separated. They are separated by a considerable gap. Origin of occipital bellies. They arise from lateral two-thirds of superior nuchal line. Insertion. Epicranial aponeurosis. They arise from lateral two-thirds of superior nuchal line and gets inserted into epicranial aponeurosis. Now supply. Occipital bellies are supplied by posterior auricular branch of facial nerve. Supplied by posterior auricular branch of facial nerve. Epicranial aponeurosis. It is also known as Galea aponeurotica. It is freely movable on the pericranium. It is freely movable on the pericranium. Anteriorly, it receives insertion of frontal bellies. Posteriorly, it receives insertion of occipital bellies. Anteriorly, it receives insertion of frontal bellies. Posteriorly, it receives insertion of occipital bellies. Posteriorly, it is attached to external occipital protuberance and the superior nuchal line in between the occipital bellies. Posteriorly, it is attached to external occipital protuberance and superior nuchal line in between the occipital bellies. On each side, it is attached to superior temporal line. Wounds of the scalp do not gape unless the epicranial aponeurosis is cut transversely. The wounds of scalp produce gap when it is cut transversely because aponeurosis is under tension in anterior-posterior directions by the tone of occipitofrontalis muscle. Fourth layer of the scalp, loose areolar tissue. This layer is made up of loose areolar tissue. It serves as a natural plane of cleavage during craniotomy. It gives passage to emissary veins. You can see this layer is made up of loose areolar tissue. It provides passage of emissary veins. Emissary veins connect intracranial dural venous sinuses to extracranial veins. Emissary veins connect intracranial dural venous sinuses to extracranial veins. Pericranium, it is outer periosteal lining of the skull bones. It is loosely attached to the skull bones, except at sutures. Pericranium is loosely attached to skull bones, but it is firmly adherent at sutures. Now supply of scalp. Scalp is supplied by 10 nerves on each side. You can see 10 nerves on each side. 5 nerves in front of the auricle and 5 nerves behind the auricle. Among the 5 nerves in front of the auricle, 4 are sensory and 1 is motor. Similarly, behind the auricle, among the 5 nerves, 4 are sensory and 1 is motor. Hence, among the 10 nerves, there are 2 motor nerves and 8 sensory nerves. 5 nerves in front of the auricle are supratrochlear nerve, supraorbital nerve, zygomaticotemporal nerve, temporal branch of facial nerve, auriculotemporal nerve. 5 nerves behind the auricle are posterior auricular nerve, great auricular nerve, lesser occipital nerve, greater occipital nerve, third occipital nerve. Sensory nerves of the scalp in front of the auricle. Supratrochlear nerve and supraorbital nerve are branches of frontal nerve. Frontal nerve is a branch of ophthalmic division of trigeminal nerve. You can see here all the sensory nerves in front of the auricle are coming from trigeminal nerve. Zygomaticotemporal nerve is a branch of zygomatic nerve that comes from maxillary division of trigeminal nerve. Auriculotemporal nerve, it is a branch of mandibular division of trigeminal nerve. Supratrochlear, supraorbital from ophthalmic division of trigeminal nerve. Zygomaticotemporal from maxillary division of trigeminal nerve. Auriculotemporal nerve is from mandibular division of trigeminal nerve. Behind the auricle, great auricular nerve, lesser occipital nerve, greater occipital nerve, third occipital nerve. Great auricular nerve, it is derived from ventral rami of C2, C3 nerves. Lesser occipital nerve, it is derived from ventral ramus of C2. Greater occipital nerve, it is derived from dorsal ramus of C2. Third occipital nerve is derived from dorsal ramus of C3. Third, 3. Remember in this way, third, 3. Third occipital nerve, C3. You can see here greater occipital nerve and third occipital nerve are present more posteriorly. Hence remember they arise from dorsal ramus of C2, dorsal ramus of C3. Great auricular nerve and lesser occipital nerve are present somewhat anteriorly. Remember ventral rami. Great auricular nerve is derived from ventral rami of C2, C3. Great auricular nerve is derived from ventral rami of C2, C3. Third occipital nerve is derived from dorsal ramus of C3. Lesser occipital is derived from ventral ramus of C2. Greater occipital nerve is derived from dorsal ramus of C2. Blood supply of scalp. Scalp is supplied by following 5 arteries on each side. 5 arteries on each side. In front of the auricle, supratrochlear artery, supraorbital artery, and superficial temporal artery. In front of the auricle, you can see this is auricle. In front of the auricle, 3 arteries: supratrochlear artery, supraorbital artery, superficial temporal artery. Behind the auricle, posterior auricular artery, occipital artery. Behind the auricle, posterior auricular artery, occipital artery. Among these arteries, superficial temporal artery, posterior auricular artery, occipital artery are branches of external carotid artery. Superficial temporal artery is terminal branch of external carotid artery. Posterior auricular artery and occipital artery arises from posterior aspect of external carotid artery. Supratrochlear and supraorbital are branches of ophthalmic artery. Ophthalmic artery is a branch arising from internal carotid artery. Internal carotid artery gives ophthalmic artery. Ophthalmic artery gives supratrochlear and supraorbital arteries. Venous drainage of scalp. Scalp is drained by following 5 veins on each side. In front of the auricle, supratrochlear vein, supraorbital vein, superficial temporal vein. Behind the auricle, posterior auricular vein and occipital vein. Supratrochlear vein and supraorbital vein unite at the medial angle of the eye to form angular vein. Angular vein continues as facial vein. Superficial temporal vein and maxillary vein join to form retromandibular vein within the parotid gland. Retromandibular vein divides into anterior division and posterior division. Anterior division of retromandibular vein joins facial vein to form common facial vein. Common facial vein drains into internal jugular vein. Posterior division of retromandibular vein unites with posterior auricular vein to form external jugular vein. Occipital vein drains into suboccipital plexus of veins. Supratrochlear vein, supraorbital vein unite at the medial angle of the eye to form angular vein. Angular vein continues as facial vein. Facial vein joins with anterior division of retromandibular vein to form common facial vein. Common facial vein drains into internal jugular vein. Posterior auricular vein unites with posterior division of retromandibular vein to form external jugular vein. External jugular vein drains into subclavian vein. Imaginary veins. They are thin walled. They are valveless veins. Imaginary veins are valveless veins. They connect extracranial veins with intracranial venous sinuses. They helps to equalize venous pressure. They pass through foramina in the cranium. Parietal imaginary veins. They pass through parietal foramen to enter superior sagittal sinus. Mastoid imaginary vein passes through mastoid foramen to enter sigmoid sinus. Parietal imaginary veins pass through parietal foramen. Mastoid imaginary veins pass through mastoid foramen. Parietal imaginary veins enter superior sagittal sinus. Mastoid imaginary vein enters sigmoid sinus. Diploic veins. They are located between outer and inner tables of skull. In between the outer table and inner table, diploic veins are present. They carry newly formed blood cells into the general circulation. 4 veins are present on each side: frontal, occipital, anterior and posterior temporal. Lymphatic drainage. Anterior part of skull drains into preauricular lymph nodes. Preauricular lymph nodes also known as superficial parotid lymph nodes. Posterior part of skull drains into postauricular lymph nodes, also known as mastoid lymph nodes, and occipital lymph nodes. Anterior part drains into preauricular lymph nodes, posterior part drains into postauricular lymph nodes and occipital lymph nodes. Let us now revise scalp. Layers of scalp. 5 layers: skin, connective tissue, aponeurotic layer, loose areolar tissue, pericranium. Nerve supply. It is supplied by 10 nerves, 5 in front of the auricle and 5 behind the auricle. Among 5, 4 are sensory and 1 is motor. 4 sensory nerves in front of the auricular, supratrochlear nerve, supraorbital nerve, zygomaticotemporal nerve, auriculotemporal nerve. 1 motor branch is temporal branch of facial nerve. Supratrochlear and supraorbital arises from frontal nerve, which arises from ophthalmic division of trigeminal nerve. Zygomaticotemporal nerve arises from zygomatic nerve, which arises from maxillary division of trigeminal nerve. Auriculotemporal nerve arises from mandibular division of trigeminal nerve. 5 nerves behind the auricular, 4 sensory and 1 motor. 1 motor is posterior auricular branch of facial nerve. It supplies occipital bellies. 4 sensory nerves behind the auricular: great auricular nerve, lesser occipital nerve, greater occipital nerve, third occipital nerve. Greater auricular nerve arises from ventral rami of C2, C3. Lesser occipital nerve arises from ventral ramus of C2. Greater occipital nerve arises from dorsal ramus of C2. Third occipital nerve arises from dorsal ramus of C3. Arterial supply. It is supplied by 5 arteries on each side, 3 in front of the auricle and 2 behind the auricle. 3 arteries in front of the auricular: supratrochlear artery, supraorbital artery and superficial temporal artery. 2 branches behind the auricular: posterior auricular artery and occipital artery. Superficial temporal, posterior auricular and occipital arteries are branches of external carotid artery. Supratrochlear and supraorbital are branches of ophthalmic artery, which is a branch of internal carotid artery. Venous drainage. It is drained by 5 veins on each side, 3 in front of the auricle, 2 behind the auricle. Supratrochlear vein, supraorbital vein, superficial temporal vein. 2 behind the auricular, posterior auricular vein and occipital vein. Supratrochlear vein and supraorbital vein unites to form angular vein, which continues as facial vein. Facial vein unites with anterior division of retromandibular vein to form common facial vein, which drains into internal jugular vein. Posterior division of retromandibular vein unites with posterior auricular vein to form external jugular vein. Occipital vein drains into suboccipital plexus of veins. Lymphatic drainage. Anterior part of skull drains into preauricular lymph nodes, also known as superficial parotid lymph nodes. Posterior part of skull drains into postauricular lymph nodes, also known as mastoid lymph nodes and occipital lymph nodes.